Well, new modelling has revealed the elimination strategy will cost the economy $319 billion, equivalent to 23% of the nation's GDP. The report by the Institute of Public Affairs estimates lockdown measures and restrictions will cost more than the annual government spending on defence, education, health and social security combined. Joining me now is an Associate Director at the Institute of Public Affairs who worked on the report, Asher Judah. Asher, great to see you tonight. This is a startling and frightening figure, isn't it? $319 billion.
It's shocking. It's shocking. And it just brings home the cost of this response to the Victorian and Australian communities and what it's going to mean long-term for our country going forward.
Asher, I was interested that in many respects the Health Minister, former Health Minister, the Victorian Government, Jenny Mikakos, let the cat out of the bag yesterday with a tweet where she referred to the eradication strategy that was being embarked upon by the Victorian Government. Now, she was quickly slapped down by her boss or her former boss, whichever way you want to look at it, Daniel Andrews. But do you get a sense that in Victoria, certainly, which seems to be the state with the most draconian of all of the lockdown rules, do you get a sense that their strategy has been eradication all along?
It's pretty clear that Dan Andrews has had an eradication strategy. All the lockdown measures are designed to eliminate the virus at any cost. But what's clear from the evidence overseas and the experience in Australia is that elimination is not possible. It can't be achieved without a vaccine, and it can't be achieved with rising transmission levels overseas.
Now, Asher, we also saw at the hotel quarantine inquiry this week where 3 very senior public servants were effectively castigated by counsel assisting, suggesting that a communication breakdown occurred there. But, you know, we live in a Westminster system in this country. And of course, you know, yes, of course, there'll be problems with bureaucrats over time. But ultimately, the buck stops with the ministers and ultimately with the Premier. Do you think that, and there have been calls, repeated calls, including some from your colleagues there at the Institute of Public Affairs, that these particular ministers, and I'm talking about Lisa Neville, I'm talking about Martin Pakula, and of course the Premier should go?
It's pretty clear in Victoria there isn't much to say about ministerial accountability anymore. It seems to be something you've heard of from another part of the country, another part of the world. If you can oversee a pandemic response that brings about 800 deaths, and the reason for those deaths is a mismanagement of your response, well, then your heads have got to roll and you've got to be held accountable. Our inquiry down here has revealed a large proportion of those deaths are directly related to their government's mismanagement of hotel quarantine. No one seems to be expecting responsibility. And the excuse, the reason why they don't think they need to be held to account is because ultimately no one was in charge. That in itself is an indictment on the government. And ultimately someone has to pay, someone has to be held accountable. And if the government doesn't deal with it quickly, then I think the public will at the ballot box at the next opportunity.
Now, Asher, your report makes it pretty clear that we're talking over $300 billion, $319 billion, in fact, as the cost of the elimination strategy. But the suppression strategy is about a third of that, about $90-odd billion. Take us through the respective differences in how you came up with those figures.
No, it's a great question. So largely there are 3 scenarios. The first scenario is that there was no COVID-19 and the economy just sailed through as it was expected to. At the far end is what we do with the COVID-19 lockdown that we've experienced in Victoria and across the country, which has the highest level economic price, where large numbers of people are unemployed, businesses are destroyed, dreams ruined, and the social distancing has prevented just basic human contact and social freedom. In the middle of that is an opportunity where at the end of April, when we had suppressed the wave, brought the numbers down to something our ICU services could handle, that is where the different scenarios emerge. So if at that point the government had said, yes, we've succeeded, mission accomplished, we've suppressed the virus, we can now go back to living with it, but within reasonable numbers, our economy would have grown and we would have returned to normal life. The problem we have now is that because of Victoria's outbreak, we've gone further along the track. We're now in late September, and all that economic damage has been done. It can't be undone. But our paper says, well, now we can do something. We have to do something. We're at breaking point in some parts of the economy, in some people's lives, and we now need to open up. Our paper has a view for how the country can move forward. It would result in the states going in different directions based on their COVID numbers. They would be grouping from 1 to 10, 10 to 100, and 100 to 500 cases. And as each state moves through those different blocks, they open up more and more. And eventually we get to a point where it's not just Queensland and WA going back to normal, it's New South Wales and Victoria as well.
It's interesting, Asher, you mentioned WA and Queensland. I mean, the premiers of those two states, the Labor premiers of those two states have been incredibly hard-nosed when it comes to lifting any form of border restrictions. Is there any evidence in your report that border restrictions, border closures work? I mean, they certainly would work in respect to the health component, but as far as the economic part of the equation, I mean, they are just causing so much drama, certainly in Queensland.
Well, I think the thing that they work best on is political support. And I think the reason those two premiers are doing it is because it's seen to be popular. The problem is it's not very effective. It's devastating their regional economies, certainly those border communities in Queensland. It's preventing that international trade and foreign student numbers that they need to sustain some of their economic output. But it's basically broken up Australia. We're no longer one country. We're operating as cells, when that was never the intent at Federation. When it comes to suppressing COVID, you don't need to lock down every border. You just need to be sensible. And the right response here has always been about balance. It's about making sure we are managing the risk, but not to the point of destroying the economy in the process. There is absolutely no point eliminating this virus for Australia to emerge in a depression environment. And unless we start opening up soon, that's exactly what we're going to have.
Asher Judah, thanks for your time tonight. Really appreciate it. Great report.
Thanks for having me.